Thank you for listening to this episode. I'm Dr. Randall Morgan, an orthopedic surgeon based in Sarasota, Florida, and I am the president and CEO of the Montague Cobb Institute. Joining me today at the National Medical Association Annual Convention and Scientific Assembly is my good friend, my mentor, and presently the board chair of the Montague Cobb NMA Health Institute, Dr. Alvin Crawford. Welcome to the podcast, Dr. Crawford.
Well, thank you very much, Dr. Morgan. Can I call you Randy and you can call me Alvin?
Please.
It's a pleasure to be here. Randy and I go back a long way. In terms of my former fellows, he ranks having been president of an international organization. We think a lot of him. I only have one fellow who was Jordanian, who was a minister of health for the Royal Hashemite Kingdom of Jordan, who supersedes him in achievement after having been under my tutelage. It's a pleasure to be here. I've been working for Randy. Randy is the president and CEO of the Montague Cobb Society and is an unbelievable resource. And I follow his lead and I conduct the meetings and we listen to the things he has to say to bring this organization forward. And it's my pleasure to be here with him.
Thank you. The Montague Cobb NMA Health Institute is an organization that grew from the National Medical Association, and it is a multi-specialty organization that's not only physicians, but focuses on health disparities and health inequities. And the beautiful part about it is that we have people from various disciplines that come together with solutions and actions. And during this particular meeting in New Orleans, we have a number of seminars and symposia, and Dr. Crawford is participating in those programs. He also will be a part of the Author's Corner, and we'll talk about his new book. It's a wonderful title, but we'll talk about that a little later. Dr. Crawford recently retired as the founding director of the Crawford Spine Center in Cincinnati at the Children's Hospital, and a renowned expert in spinal deformities and neurofibromatosis, a genetic disorder often associated with scoliosis or curvature of the spine. And first of all, I would like to tell the audience, for him to tell the audience about his milestones of a truly fabulous trailblazing career. And Dr. Crawford, would you want to maybe emphasize a few of those milestones?
Yes, I think probably if there's a contribution, it's getting into the field of medicine. I was a music major in college, didn't achieve the goals that I'd set out about. My brother said, you've always been interested in challenges. Have you thought of medicine? I said, absolutely not. He said, well, why not think about it? And I said, oh, well, let me think about it. At that time, all I could think about in medicine was going through all the science and all that. I found out an interesting story that others should know is that to get into medical school, you don't necessarily have to be a science major. It helps, of course, but you have to pass a medical college aptitude test, do well on that, and then there are prerequisites that they have, and I was able to get through those. But then I found that it was a love that was not lost, but that I hadn't found, and have been extremely happy with my career in medicine, specifically orthopedics. And even though I am not in general medicine, have been able to be in a field called pediatric orthopedics. It is to take care of children with musculoskeletal or orthopedic diseases. And it's been just simply wonderful. I've enjoyed every single minute of it and have enjoyed having stalwarts like Dr. Morgan as fellows who've come to visit me in the second part of their life that I'm really proud of.
And everyone should know that Dr. Crawford actually started his work in Detroit, Michigan, at Henry Ford, and built an outstanding reputation there in pediatric orthopedics. And in the middle 70s was recruited to Cincinnati and to the Children's Hospital. And more than that, he has built that program to be one of the signature pediatric orthopedic programs in the United States. And for that, I am very proud. I'm from Indiana, and so when I went to be a fellow, I actually was in medical practice, had been in practice for 11 years. And so I had to learn how to be a fellow with Dr. Crawford, and then in the evening it was Randy and Al. And also I tried not to be the principal for the residents, but to be one of the residents and to do everything that they did. And I was very invigorated by that experience. So I would recommend it, a mid-career type of adjustment for many, many different professionals.
It was
Eh,
so good to have Randy, and that he had a wealth of knowledge, and he was an excellent surgeon, and the residents got to be able to be with him. And it was really interesting because sometimes been accused of maybe coming down a little hard, maybe strong, maybe difficult, maybe whatever. And they had a buffer in Randy when he was there, and they enjoyed him. We enjoyed him, and we've seen what his career has been since he left Cincinnati. In the social political aspect of medicine and multidisciplinary, especially as we get to disparities, of which he is an I would say creatively an experienced expert in managing through the Cobb Institute.
Al, I'd like to maybe kind of go back a little bit because I know one of the things that you are very interested in, and I think what's captivated you with the Cobb Institute is the opportunity to mentor and to look at some of the pathways slash pipeline programs. And I'm looking at it from the point of view of trying to predict which students would benefit from pipeline programs because we only have a certain number of resources. We only have only a few who really are expert at moving individuals along in the pathway. And so retrospectively, if you think about Memphis and think about your family, what do you think your brother saw in you that made him think that medicine was the field for you?
Well, it had to do, I think, with my history. As I said, I went through high school as a musician. I started in college, but I did something a little bit uncomfortable. I aced the Stanford Binet in the sixth grade. And from that time, I went to a school, all black school, and I had teachers who loved the kids. And the thing was that, by God, if we could just get this kid out of music, he could make something of himself. And so I had the discipline aspect of it. And he said, "You like challenges," and I'd loved challenges all my life. And then you have to pass MCAT, and people don't realize it's not always just purely science. They were trying to find a new doctor then, someone who was a bit more broad-minded in their aspects. So, and to do that, Educational Testing Service actually tell us an exam to find them out. And lo and behold, when I took the medical college aptitude test, I sat down in front of a fine arts exam, and I was a music major. So, needless to say, I didn't have any difficulty with that, but got in it. And I found out something, Randy, and this has to be studied: musicians in medicine. And for whatever reasons, they do really, really well. And I've been looking at it because the dean of the School of Jazz at the University of Cincinnati College Conservatory of Music says our kids that drop out, there's a certain segment of the population to live in the same house. Your mother will have to be able to say, "My son, the doctor." And so they sometimes find that out in their second year of the conservatory, and they go to medical school. But it's a discipline. If you're in the seventh grade and you have to give a recital, then your instructor is not about to let you take the music. So you have to memorize. So musicians as well as junior medical students, you have to memorize stuff. For us, the Krebs citric acid cycle, which I'm sure you've memorized and know today. But anyway, things you have to do. And I think that's it. You have a discipline. You have a discipline of listening, looking. You're looking for the key change in signatures. And so I think it's the same thing. And we're trying to look into that now because the chief of the jazz school at the conservatory has said he's noticed that, how well the kids who drop out of the conservatory do in medicine. And I've seen that, and I think there's something to it. But what I've been involved, let's get back to the question, is that you can be what you can see. And that's why I've gotten into Black men in medicine, because some medical students, as well as young kids, perhaps especially in the African American community, have maybe never seen an African American doctor, and especially a male. And so they're interested in that. And I'm trying to solve the riddle. That is, you can be what you can see. And that's what we do. It is not a recruiting. The dean feels it has been good for recruiting, but it is sustaining and allowing you, hopefully, to finish the discipline of medical school within 4 to 5 years. And I think that's my goal. That's been my goal. And that's the way I'd like to keep it. I've gotten really involved in that. I was concerned with COVID that we couldn't congregate, but the interesting thing about virtual is that everyone gets the same thing. It wasn't that you sat with a person at that stage. It was sort of like a dating game. You'd sit with Dr. So-and-so. Well, Dr. So-and-so might be up for the 4 that are in it with you, and then maybe down for the other. Here, everybody gets the same thing. It's phenomenal. And I really like it. And it's going to be difficult if we get to the point of having to eliminate virtual, which some centers have, to be able to do it. It's worked very, very, very. And you can mute and listen. You don't. It's good. And I'm not giving a commercial for virtual, but it's been good for us.
Well, virtual presentations, virtual participation requires a lot of concentration. And if you concentrate, you can pick up just about everything that everybody says. And there's usually a thread to every kind of conversation. The other point is that you can relate directly to who's speaking because their name is on the box.
Mm-hmm.
And so therefore, you don't always have to think about, well, who said this or who said what.
And
point.
You can record it.
You can record it and you can
yes.
take notes, which is what we do with our Cobb Institute, because we only meet as a board quarterly. And we have committees that meet as well, but we carry out a lot of work at that. And the reason we're able to do it is because we focus, we concentrate, we can use our recordings, and we can have special virtual programs like webinars or town hall discussions, and you can multitask. So I think that technology is here to stay. I don't think there's any question. But also I keep going back to your background because of the similarities and the differences in my background and how I got to where I am and how you got to where you are. And I think this is a question that's very important, as we will hear even tomorrow at the Cobb Symposium, speaking about the anti-affirmative action and speaking about the Supreme Court, how we are going to be successful, regardless of where we came from or how well we're seen. And are we going to be able to be seen well enough to be heard and heard well enough to be a successful applicant? And once we get to that place of getting to medical school, are we going to be able to take advantage of it?
Well, that's such a great question, because it puts the job on us. Because I think now we have to think back, and some of them, God forbid, if you're as old as I am, then you were before affirmative action. So you knew at that time you had to buckle down and get it done. And I think with the quote unquote pipeline programs of having kids who are interested, if they want to invest in it, they've got to invest lots and lots of time and get it done, because, it's amazing. I would not like to be in some symposium and some wise says something like, well, he was in affirmative action. I was before that, but I was dedicated. I had mentors who stimulated me to do what needed to be done. I mean, the course of medicine is not going to change. If you make that your goal and your objective, and you have to sort of maybe thread thin on the social political issues for perhaps 4 years, which is such a short period of your life, you can get it done. So I think about it, but I'm from a generation where I don't have to worry about it because we did it before and we're going to do it afterwards. And we're ultimately, I don't know what ultimate would be. I once thought that everything we went through would be significant. And now I'm hearing with quote unquote critical race theories that politicians are saying that never happened. And I must mention something you didn't, that I was actually the first person of color to attend the University of Cincinnati College of Medicine. It was not necessarily easy at the time. The dean met me, and I'd gone to Tennessee State. I graduated as a valedictorian. He said, "We don't recognize Tennessee State as an accredited university." And I spent a quarter at Meharry, and he said, "Well, we don't recognize Meharry as an accredited." And I did fairly well in anatomy and scored some things, but could not be, quote unquote, elevated to the dean's list because I'd had the material before, which was 6 weeks. So it was an ordeal. But I think what we have to do is we have to go back to my mother's generation of, if the kids want to do it, training them to get it done. We can't. The politicians will take care of the other. And I mentioned to a group this morning, vote, register to vote. We're seeing things like in Ohio now, areas that are being gerrymandered to the point that you can live there, and if you're a color, you don't have a vote at all. So we get back to it. But the Supreme Court, and then that changes. I used to feel that whatever bad was happening to me, one day Martin Luther King would talk about it, and Thurgood Marshall would have to get it done legally. We've got to be. It's going to be a work. I hate to say that. At the end of the day, I am going to say, for kids who look like me, or as well as kids in general in the field of medicine, be prepared to work your butt off, do it, and it'll work.
Thinking back at that same time, did you have any contact with physicians of color in Memphis? Were there any that you would consider to have been a mentor to you?
Oh, absolutely. Because my mother worked at this hospital, and I subsequently got a job there, and it was the hospital for color, and we had surgeons and primary care physicians. And the thing about it, and I can't say I had an edge up, but they had quarters there for the interns and residents, and I was called an extern. And so I stayed there. So it was really interesting. The nurses got to know me, I got to know them. And if someone, God forbid, I was in medical school, but if someone had a case late in the evening or after medical school, they'd ask the chief nurse in surgery, "Look, do you have anyone that could help with this?" She said, "Well, Student Crawford is here and he loves to come down. Give him a call and he'll come down." And so, I got to the point, you go through the series of watching the incision, making the incision, then the closure. And then the one that's in the middle of those is that to do something within the incision, but it comes up for the safety of the patient. And I got to do a lot of that. And so a lot of the procedures that I came through in the junior year, I literally scrubbed with people. And we had excellent surgeons of color there who allowed me to scrub with them and so forth and so on. And that was my experience.
And Memphis, Tennessee was one of the key cities early in the history of the National Medical Association, along with Nashville. And so being able to meet many of these doctors, most of whom were probably in the National Medical Association,
they were in
must
what's
have been
called
real impactful.
it was called the Bluff City Medical Society. Memphis being the Bluff City, it was there. And the thing about it, there were a lot of legacies, and they were physicians because their father, their uncle, their grandfather, whatever. And I got to know them, and they got to know me. So it was good. And in terms of mentoring, they were never hesitant about anything quote unquote interesting when I was a medical student to give me a call during my time off, and I could go to their office and see what they were doing. So it was good, and it was a side issue, and one could say, well, was that an advantage for you? And the answer was yes, because I didn't have a lot of friends, and there's a story to that. I think the young people should know it wasn't because, quote unquote, everyone hated me and wouldn't be my friend. There was a Plessy versus Ferguson, separate but equal. It could be illegal in a place to congregate of races, and one of my medical school colleagues could be literally arrested, and vice versa. So that's the thing, and it gets to me now with quote unquote the congressman whose granddaughter, who's 7 years old, was home crying because somebody told her about the slavery and so forth and so on. But there were laws. It was literally illegal. So in terms of study partners, in terms of all that, it was problematic. But I think what we're doing with especially BMIMC and mentoring process, such as the National Medical Association and the Cobb Institute, I think we can get kids to have some standalone confidence. And we don't really know how that's going to realign itself in the future. But those were very, very difficult times. And it was difficult times for all of us.
So the reality is, in spite of the preparations around medical school education, the pathway from medical school through residency, fellowship, early careers in medicine, the formative years really, I think, make the difference in terms of who's successful and who isn't. And so you have described Memphis circa your time as a young kid and how you became interested in medicine. And it very much parallels my community and a different location. So a little north of Tennessee, still de facto segregated.
Mm-hmm.
Didn't have to worry about Plessy versus Ferguson per se, but never had a white classmate or a white teacher in 13 years of education until I went to college. And so I was able to learn what I did because my dad had a drugstore in town and all of his friends were the doctors in town. So I knew at least 20 African American physicians and even a couple of women physicians. By the time I was a junior in high school, I knew them. They were personal friends, and I knew their children. So as I look back on it, that was a part of my formation of being a physician. And
Randy, you have no idea as to how good that was. You know, my children grew up, quote unquote, in an integrated world. And there are issues that occur that affect them for life in terms of being maybe the only one or two in a class, the instructor making objective, ridiculous comments, them being isolated, et cetera, et cetera. And especially in a private school that I was paying for. But you know, my son in about the 11th grade scored extremely well on a science exam. And one of the, well, it was Catholics who brought him in to speak to him about it. So, you know, you have really, really done well on this exam. And I want you to know that with grades like this or with a score like this, you could do something in medicine. You could be an x-ray tech or possibly a phlebotomist or something, and it would be really good. You could find a career and something you might want to think about it. And, you know, as you're thinking about that, that's a long way. And I need to know about your family. Does your father live with you? He said, yes. And he said, well, does he work? And he said, yes. And he said, well, what does your father do? He says, he's chief of orthopedics at Cincinnati Children's and a professor of medicine. And that was the end of the conversation. The fellow never said another word to him since then. So, you know, there are things that happen and things that happen. It has caused me to feel really, really good about HUBCs, about historically Black universities now, and getting through them and the legacies that occur with them. And now I've found out that they have affirmative action and they have inclusion, which means if you're Caucasian and you're from poor circumstances, you can get a scholarship there. And so it works out that they're together and so forth. But there's a lot that's good that goes on in this world and this sociologically. And getting back to your question, that's going to be a situation for the legal people to look at. We have a Supreme Court now that's been directed by someone who's ultra-conservative, and I didn't know that they'd get to a point where they're following actually the treatise that he said, and we'll see how it goes. But in the meantime, I'd like for things like BMIMC in Cincinnati and the Cobb Foundation to give kids who are interested in this field a firm background, and I think there are two things they need to do. One, the ability to listen. And from being able to listen, I always tell my boot camp kids that God gave you one mouth but two ears, and there's a message there to listen, and then the other is to observe, to be focused. And it's amazing what you can hear by listening, but also amazing what you can see by looking. And so that's my philosophy. So I'm not going to be one of the fighters to get us back to the point of affirmative action. I'm going to be the one of the fighters of making every human who comes under my care one that I can treat him with an F-square principle, like a friend or family. But the other is that all the kids who appear to be interested, I can do all I can to support them in any way that I can.
So with that in mind, let's turn to 2 points, and they probably will be interactive based on your upcoming book. And this is literally the debut of your book and the work that you've done for the past few years. Much of that has been described, I'm sure, in this podcast today. And the title of the book is The Bone Doctor's Concerto. And that's certainly a title that just anybody going to the bookstore would totally understand what it meant. And I say that tongue in cheek, that one would first of all have to know what a concerto is and what relationship that it has, to a bone doctor. So could you begin to kind of give us some orientation?
Sure. The first is easy. The bone doctor is because I became an orthopedic surgeon. So by default, I'm a bone doctor. The music part has been a tremendous part of my life, and it continues to be a part of my life. I play in the Queen City Concert Band. I also play in the University of Cincinnati's community band, and I play in a jazz group that's outside of that. I've been also involved in teaching jazz history, which is good because the jazzers who are sort of dying out, but Coltrane and Charlie Parker, Bird, as you would call them, were people that were my generation. They're no longer here on this earth, but I can remember it actually being in competition with that. But no, so the concerto, and if we can get to the point where they will realize that medicine can be a performance and can be significant, and you get to the point that you're as fulfilled with that as you are with anything else, and it can be your concerto. And I like it that in the conservatory music, it's a different level of learning, and that any jazz musician who doesn't know maybe 100 tunes off the top is not a working musician. The other thing in the conservatory, every tune that you learn, you have to learn in all 12 keys. Now, equate that to medicine and think of the Krebs citric acid cycle of what you have to know and to memorize, and you have to put the same emphasis on it. So I'm good with all of that and with the concerto. And I hope that people who have the opportunity to read the book will see what a pleasure my life has been, and to know that I was able to bring the two disciplines together for myself, and would hope people would be interested in that. Perhaps it influenced some young humans to pursue that trail.
I too have identified the connection between medicine and music. And I'm just wondering whether or not you've actually studied this from an anatomical perspective or a neurological perspective, or even, from a cognitive perspective.
Yes, and I'm in the process of studying it now. And I've been interested in musicians and medicine. The American College of Surgeons has several articles on it. And people who think, I saw an article on Condoleezza Rice, who was a concert pianist. That's how she got started. And as we were saying earlier, And I started in 7th grade. If you started early, your teacher, you have these recitals and things. The instructor is not going to let you do it with music, with sheets there. And so you have to learn it. And in medicine, you have to learn stuff and stuff and stuff. And if you put the same part of whatever your brain that gives you the ability to memorize stuff, it works in that. So I think there's a definite correlation in terms of the discipline required in studying for music as well as medicine, but also the rewards. I know what rewards I get out of medicine, and I'm trying to work back to get some rewards out of music as my career goes on.
So, in order to be successful, you have to have certainly preparation, but you have to have confidence and you have to have resilience, particularly in today's society, in terms of the academic centers, in terms of practice of medicine.
Yeah.
In order to be a successful physician, shall I say. But in music, you have to have the same.
Yes, you would have to grow up to be one of my children. Actually, you wouldn't want to end up growing up as one of my children.
I remember your
Because
children.
they were directly influenced, like at every dinner, with the mid complex, and that's what their dad had. And they had to go back. And mid is motivation, industry, integrity, and desire. If we put those principles there, you'll get it done. And that can be applied to whatever there is in this life that you're espoused to be involved in. And hopefully I gave them a bit of that and tried that. As you well know, I teach what's called a boot camp for young residents and medical students. There are people now, a lot of without conscription, there are not a lot of kids who've been in the military, and they don't know what a boot camp is. And I just simply say, that's where you teach the neophytes which end of the gun to point that away, which end of the gun. But anyway, it's getting the basics, and we go through that and how the kids are. And so I'm able to get involved with them learning and doing that, in addition to the joys that they can get out of surgery and taking care of people, which is tremendous.
So we're near the end of our discussion today, and I would just like to ask you to reflect on someone who was someone who was influential in my life and in your life, Dr. Mike Tashin from Northwestern, pediatric orthopedic surgeon, gentleman, world traveler, and every man. Can you talk about Mike Tashin?
Oh my God, we don't have enough time to talk about Mike Tashin. Mike Tashin was Armenian, and I didn't know the racial slurs about father being a rug dealer, but his father was a rug dealer. But Mike was a concert pianist. A lot of people don't know that. You were a student. You probably remember that. But anyway, Mike, I had been with G. Dean McEwen at the Alfred I. DuPont Institute, and Mike had this course. It was pediatric orthopedics, and the youngsters wouldn't know that pediatric orthopedics was not a part of a lot of programs. However, it was a part of the exam, so everyone had to learn some pediatric orthopedics. So Mike developed this course in Chicago, and it was bipolar. It was in Chicago one year and in San Francisco the next year. And there were people who didn't have, except if there was a Shrine Hospital or something in their program, they didn't know an awful lot. And so they would attend this. So he had a given course that it was going to be full. And you'd see 600 or 700 people there. And they were all busy writing down every word. But Mike, to me, was possibly responsible for me to be in front of a large audience and to emote. And Mike, and there were lots of Southerners on his course. He actually recruited me very early. I think I may have still been in Detroit, just getting ready to go and you could say he did the best for me, and I don't call it abuse, but Mike would call me. It would be on maybe a Wednesday, and it was really, he would say, and he had he said, Alvin, I just heard about the talk you gave, and it said, it was on such and such. And he said, I think on Thursday, you might be able to give a talk on such and such. And, I was one of the youngsters in the group. And so, the course would last literally from 7 in the morning to 10 o'clock at night. And he'd have me on the 9 o'clock to 9:30.
I sat in many of those courses.
What's that? And so I was able to present to large audiences and get my stuff together because you would have the breakout session. So he was very, very interested. He knew me. It was really interesting. I thought he just tore my job up in Cincinnati and just it was going to be the end of me. There were people in Cincinnati that were concerned. And he said, well, yes, we want to hire him, but we're not sure he's ready to be chief. And so they knew Tadger and Mike says, you can do whatever you want. If you hire him, he will be chief within 1 year, or you can hire him as chief. You can do it either way you want to. But if you hire him, he will be chief and your program will be better than ever. And that's probably one of the nicest things that's ever been said. And I was fortunate. 2 years ago, I wrote a memorandum, a memorial to Mike Tadger. It's presented in the electronic version, orthopedics, of pediatric orthopedics, their electronic version. And so I can't say enough about him and what he did for me at that stage in my career to get me to be in front of audiences and so forth. Never forget him.
Well, thank you, Al, for this stimulating discussion today. I think our listeners have learned a lot. I think they've learned about the non-traditional ways that we become physicians, how we maintain our sanity, for lack of a better term. Dr. LaSalle Lafall, my mentor at Howard General Surgery, used to always talk about maintaining equanimity amidst distress. And so it's all about being a surgeon and all about maintaining your control of the situation. And
I admired that man very much. And when I was stepping down at Children's, I had never been associated with a minority institution. And the Gladden Society was kind enough, and I should mention that the Gladden Society, John Robert Gladden, was the first person of color to pass the boards of orthopedic surgery and was admitted to the AAOS. And now, as a part of the NMA and as part of orthopedics, about 12 or 13 guys who got together to form the Gladden Society. But I was in a meeting before coming here, and there's a picture of me trying to recover roots of African Americans and going to Howard University and visiting their library where 3 of the gods are in the library. One is Montague Cobb, the other is LaSalle Lafall. And I actually showed a picture about an hour or 2 ago of he and I when I went there on a sabbatical, and Charles Drew. And we shouldn't forget Charles Drew, who's the person of color who developed blood banking.
right.
And as difficult as it may be, he was in an accident. It's alleged that he died because of not being able to get a transfusion. Apparently his injuries were more than that. But he was the man, African American, who developed the way blood is utilized effectively in humans, and we should salute that. But no, those were 3 of the gods, and I guess you were under the influence of those 3 gods as you pursued medicine.
Yeah,
in the
I'm
undergraduate
very
stage.
fortunate. Very fortunate. Well, thank you so much, and look forward to the next time.
It'll be soon. Thank you.